Nationally, now more than 57% of office-based physicians use an EHR of some sort. So we've truly reached a tipping point in EHR adoption in America. In Ohio, it's 59%, and I need to get to the right slide here. It's 58% in Indiana and 46% in Kentucky. So using technology in healthcare is no longer something that's exotic. It's something that is the norm. And as patients, I know we're often looking for a provider practice where we know an EHR is in use. Additionally, Ohio is one of 5 states in the country where use of health technology is so common that ONC has tapped a diverse group of organizations to work with them to accelerate meaningful use. Ohio's health IT leaders have committed to helping Ohio reach 10,000 eligible providers meeting meaningful use in 2012. So that's this year. Nearly 7,000 primary care physicians have signed up to work with Ohio's RECs on the adoption of electronic health records, so we're well on our way to that goal. Those 7,000 providers are only the primary care providers, and the 10,000 goal includes both primary care and specialists. A study conducted in Cleveland, where there is widespread EHR adoption, analyzed the health records of 27,000 diabetic patients. Researchers found that providers with electronic health records were 6 times more likely to show improved diabetic outcomes than those whose doctors used paper records. So the acceleration toward meaningful use is not about incentives, important as they are. It's also an acceleration in our ability to provide better care and better outcomes for patients. In Kentucky, the Medicaid EHR incentive program was so on the ball that they paid out the first check to a hospital over a year ago in January of 2011 and are among the leaders in getting incentive funds out the door. Indiana is seen as a leader in health information exchange with 5 robust health information exchanges regionally placed around the state, including HealthBridge and HealthLink in Bloomington, working together to share better information for better patient care. So the message in all this is that now is the time to really be serious about achieving meaningful use stage 1, and later this afternoon there will be a session on stage 2, which is around the corner, and invite anyone interested in hearing the proposed rules for that to attend that session. Adding to the urgency is stage 2 meaningful use, and the proposed rules will be discussed in session 2B. If you have seen these rules, you know what advanced practices here in Cincinnati are working on today will be the norm in 2014. The practices that are in particular working with our Beacon program are attempting to do many of the things that we see as aims in the 2014 Stage 2 Meaningful Use regulations. So again, there's no need to wait. The time is now. If you're not working on these capabilities today, the Tri-State Regional Extension Center can be of assistance to you, and as well as HealthBridge. You may be surprised by your colleagues who have already been paid that they will certainly tell you that we had an impact in their success. If you are on the fence, contact us and we'll be able to provide you more information on how we can help. At this time, and last year, as I said, we recognized 2 practices. The Office of the National Coordinator launched a program shortly after our event last year called MOVERS, M-U-V-E-R-S, and it stood for the Meaningful Use Vanguards. And so the early adopters of EHR technology and those that worked diligently to be amongst the first to achieve meaningful use were identified as that vanguard, and today we'd like to recognize some of those. I'm going to ask Mary Zeil and Keith Hepp, and is Craig Bremer here? Craig, are you in the room? There's Craig. To come up, Craig is going to represent us for these recognitions as our representative from Office of the National Coordinator, Keith as the CEO for HealthBridge, and Mary Zeil, who manages our practice consulting work in the HealthBridge portion of the Tri-State Regional Extension Center. I'll read off the names for these practices, and each practice will be provided a certificate signed by Dr. Farzad Mostashari of the Office of the National Coordinator, recognizing their significant work and their attestation for stage 1 meaningful use. So first, I'd like to have Leah Bruni and Dr. Frazier. If Dr. Frazier's in, Dr. Frazier's not here, is he? Okay, so he's got patients today. But Leah has done tremendous work, and congratulations to Summit Family Physicians in achieving stage 1 meaningful use. I want to add that Summit was a paper practice. So prior to July, I think, of last year, it was a fully paper practice, never been on an EHR. And they did a tremendous job of getting their EHR up and then starting their 90-day attestation period and being done by the end of the year. So terrific work, Leah. Summit's also a beacon practice, so while they're just kind of doing all that, they're also doing patient-centered medical home and participating in the quality improvement innovations that are part of Beacon. So a very busy practice. Next, the Family Practice Associates of Middleton, Sandy Schellenberger and Deborah Southard. Are both of you here? Congratulations. Thirdly, I have the practice of Katz, Cade, and Hewitt. Do we have a representative, Dr. Katz or Cade, or? Come on down. Also a very early adopter. They were on an EHR when stage 1 meaningful use regs came out, but worked hard to make improvements in that and meet all those new requirements that they may not have met before. Next, we have Claremont Internist Associates and Sharon Wood. Sharon, are you here? There she is. They all sat in the back, except Leah. Thank you, Leah. For those of you who are on the path, you know how much work goes into this, and I appreciate the feedback several of you have given regarding the assistance the REC's given on that journey. So it gives us encouragement to keep up the good battle and work even harder. Next, I have the St. Elizabeth Physicians and Dr. Glenn Loomis. Glenn, are you here? Great. Glenn's going to take credit for over 100 attested physician meaningful users. So absolutely great job at St. E's, and Dr. Loomis, your leadership's really made a big difference, so thank you so much. Another one of our Cincinnati health systems, Mercy Health, if Aaron Brock is here. Great. And we have the majority of the Mercy Medical Associates physicians have attested. I think a total of 86 at the end of the year, and another couple dozen are still on the path to meaningful use, but Mercy's done an awesome job getting the job done in 2011 and early part of 2012. Thanks, Aaron. The Family Practice Associates of Lexington, Susan Miller and Shannon Riddle. Either here? There we go. Okay, and we had one more to recognize, Dr. Deborah Fritz, but Dr. Fritz could not be here today, so we want to just give her a round of applause in the practice there. If you're in the room and you are a member, whether a clinician or office staff of one of the practices just recognized, would you just please stand up? All right. And remain standing if you would. If you're in the room and you are working in a practice that has also attested but was not working with the Regional Extension Center, which would be many of our specialists, if your practice has attested to stage 1 meaningful use, everyone from that practice, please stand up. Awesome. All right. As a regional extension center, and thank you all for the ample job of handshaking and smiling. As a regional extension center, our principal responsibility is to work with primary care providers, although we do work with some specialists as well. As a goal, this regional extension center was to reach 1,740 providers, to engage them and support them in reaching meaningful use for stage 1. We've actually recruited about 100 more than that, around 1,840, that we're actually working with. And I've committed to the Health Bridge Board that we will get and work with, we will get 70% of those to meaningful use by the end of this year. So that is, we're at about 18% right now. We have a big gap to fill, but I know that we will get there. One of the reasons I know it is there's about a $5,000 difference to the physician if they put it off another year. So I know you're incented, and we're incented to help. So 70% by the end of the year. When we meet here next year, I hope to be able to report that we did even more than that.